Welcome to Health Talk. Thank you for joining us today. We're really excited about our topic. What is compassion training and what can it do for you? With us today we have Casey Branscomb of the Compassion Institute. She's the executive director. And we have with us Dr. Leah Weiss, founding faculty member of the Compassion Institute and lecturer at Stanford University. So what is compassion training? I'm so excited to learn about it. It's been in the news. Tell us.
Compassion training is, first of all, from the perspective of research. Up till about 10 years ago, we thought that a quality like compassion would be something that was set once you reach adulthood. And what's been really interesting is to learn what traditions who've been practicing and teaching compassion for thousands of years, now science is catching up with the idea that adults can increase our compassion levels. And we've been studying the best ways to do that most efficiently and impactfully.
Oh, so compassion training, is there like a method? Do we start off with step 1, step 2? What do we do? And where do we go if you're kind of sad and you're had the diagnosis of cancer, and there must be 2 points of view: the patient who has the cancer and the caregivers, the family members. Tell us about that.
Yes, absolutely. So as a family member, for me, when I became deeply interested in this topic was when I was an undergraduate at Stanford. My father was diagnosed with the cancer that eventually took his life. And at that point, I became deeply interested from a personal level about how could I strengthen my ability to respond to what he was going through and also to support him. And he was a physician, so he was very well informed. But sometimes doctors aren't the easiest patients.
Yes. Having been a patient and being a doctor, yes. So then when you got into this compassion training, what did you find? Tell us a little bit about the science behind it and all the PET scans that they have about meditation. Tell us.
It's a very exciting time for the study of science, the study of compassion and the science of compassion right now, because there's so many biomarkers that are looking at the impact on the body as well as the mind in terms of how compassion benefits our health. So some of the most exciting studies at Stanford, Brian Knutson in the psychology department has been doing fMRI research, looking at adepts, at monastics who have been training in compassion meditation for decades, and seeing how that looks in their brains when he puts them inside an fMRI machine. And one of the most interesting findings that I think actually relates to how we would define compassion is that what he sees when he's studied these monastics doing compassion practice in the fMRI machine is that actually the reward regions of their brain light up, which turns on its head an idea that many of us have about compassion, that it means to be compassionate for someone's suffering means that we have to be emotional, we might have to overly take on the struggle, whereas what these monastics, these experts, are showing us is that actually when we get the training and the experience of compassion right, it is a pleasurable experience, which in turn has enormous implications for healthcare providers and other people when we're in our day-to-day lives needing to find the resources to be resilient in the face of ongoing suffering.
Now, off air, Casey and I had a conversation, and that she changed her own life with atrial fibrillation and with this type of training. And Casey, how did you find Dr. Weiss and to create this kind of Compassion Institute? And tell us.
Sure. Well, first of all, I can't take any credit for creating the Compassion Institute. I just am offering myself as a service and dedicating myself to it for 2 years because I'm so passionate about the impact this can have for people just generally. I mean, it's had a huge, I've taken the course twice, it's had a huge impact on my own life. And I guess, to put it in very, very sort of more simple or familiar terms, I mean, this is a way to basically get back to who you really are. We're all born, and there's a lot of scientific evidence that, children are always very, little kids will always reach out to someone who's missing a toy or crying. And what I think we're learning, and what this course has taught me, is that if you can move past pure empathy, if you can move past sort of taking someone else's suffering and discomfort into yourself, and you can transform that into something motivating and positive and actionable, it actually is a win-win. It's a win for the person that you're trying to help, or that your loved one, your husband, your child that maybe needs your comfort. But it's also a win for you. You feel better about yourself. You feel happy, like she said.
Yeah.
The brain centers of reward, light up. I mean, I look in the mirror and I like, wow, I did that. I did something positive. I made the world a little bit better than I found it today. And even if I didn't, just believing that and permitting myself to be that person, I find motivating and invigorating.
So for you, in the finding out about all this research about the fMRIs and the reward centers, so are there like endorphins released, or?
There's so many different ways that compassion impacts our bodies, right down to the cellular level. Some of the research that's been getting a lot of attention as of late has to do with the telomeres, and how actually doing mindfulness, meditation, contemplative practice, compassion practice has an impact. So the telomeres, as you know, but for our viewers, it might be useful to remind. So if you think of the strands of DNA as a shoelace, the telomeres are like the cap, that plastic coating at the end of the shoelace that keeps them from unraveling. So as we age and as we become stressed, these telomeres shrink and shrink and shrink. But what we've learned through research right up at UCSF is that when you meditate, when people, even novice meditators, newcomers to meditation, take an 8-week class, their telomeres actually lengthen.
Which also is found
altering your DNA.
Right.
I mean, that's amazing.
It lengthens your life. And they found this
potentially it can expand your lifetime. I mean, the Tibetan Buddhists, if you look at their diet and other things, they're not, particularly models of eating organic, for example. But they live in a really hostile environment very, very long lives. And one of the reasons, apparently, is that because within that community, there's, a 2,000-year-old tradition of meditating on compassion. There are a whole series of sort of meditative exercises that they've learned, and it is affecting their health and longevity. I mean, it's amazing. So we've combined that with modern psychotherapy and psychoanalysis techniques and group therapy techniques to form a course that you can take one night a week, 8 weeks. You do have some homework for meditation that you need to, try to build that practice up over those 8 weeks. But, not for everybody, but for the majority of people that go through those classes, they can be truly transformative. I mean, they feel like they're back more to the person they always knew they were, but just couldn't seem to kind of be every day. And we see a lot of happier, healthier people.
In England, for example, it's mindfulness courses are covered by health insurance. So we're at a place now where hospitals across the country, around the world, offer these trainings. And it's also an interesting time because the focus is both, as you pointed out, on the patients, but also on the providers, trying to address these enormously high rates of burnout and struggle among healthcare providers. So this is one of the techniques that's really being looked to respond to this crisis of burnout and physicians decreasing hours, leaving the field, let alone, as you know, the high rates of substance abuse and even suicide. 400 physicians a year commit suicide in this country. The stress that they're responding to is vast. So I think it's important to to keep in mind that, as Casey was speaking about in the last show, that when we show up as patients and family members, really being a proactive part of the team and engaging with our physician and also drawing them out in their humanity and responsiveness seems like not just a nice to have, but an absolutely necessary way to be healthy today.
Well, we're all bombarded by the internet, technological advances that give us no time, because now they can reach us 24/7, emails, and even though it sounds fun to talk to India and talk to China and talk to Africa at a split second, there's a lot of demands. So you have no time. It's very hard to carve out the time to find the quietness.
Yeah, I
can
relate to that.
Absolutely. So it's very hectic, and the demands for everybody. Now,
But the rewards are great, Gloria. Just 20 minutes a day.
I'm going to sign up. I love this. This is good. I want to know.
I mean, why wouldn't you invest 20 minutes of a 24-hour day to be a happier, healthier, more emotionally balanced person? I
do agree. I think it's very important.
It's a small risk and a small investment for a huge upside.
And living to age 120.
Right.
And I can't promise you that.
It becomes more possible. I can relate to the time crunch. I have 3 children under 6 and work full time, and I still am firmly committed to the fact that spending that time both on the cushion and then interspersing this attitude into the day-to-day moments, it creates time, it creates space, it brings us back to where we want to be in our professional and personal lives in a way that, just like people when they get used to exercising, there's no way they would give that up because their whole day is going to be impacted if they miss it. It's the same dynamic. So I think in a lot of ways what it comes back to is behavior change and getting over that initial hump to create the habit, which, as Casey pointed out in the last segment, that an 8-week class in a community is a very supportive way of doing that. And I think when we look at the research studies about the development of compassion and of mindfulness, that having that structure to get the initial habit formed can be very helpful for then people carrying it forward.
In the olden days, when people went to church, they prayed every day, which was a form of a sense of gratitude, of connecting to the greater world, thinking that there was a greater being. And I know that at the Yale studies, the PET scans, they looked at priests who prayed, monks who prayed, and they hooked them up to PET scans, and that there was a loss of brain activity, kind of a quiet. So it allowed the neurons to regenerate, and these studies are probably 10 years old. So your studies
like
about
deep sleep.
Right.
Yeah.
The telomeres are even better, that we all want to live longer, healthier lives that are more meaningful, rather than, as Casey once said to me off air, it's not about dying, but it's about living, like the positive aspect,
It's not about not dying.
Right.
It's more important. Sometimes we spend so much time being afraid of dying that we forget to live.
Right.
And that, I want to come back to one thing that you said, just to clarify. Mindfulness, which is the first step, the ability to meditate, to be able to have a connection to your inner voice, have a connection to all your thoughts and the busy mind that we have of these thoughts that are rushing. We can develop habits of quieting that voice, of having a dialogue with ourselves that is more positive, more self-appreciative, more open-minded about other people, less reactive when we're encountering somebody that maybe isn't so friendly or doesn't react to us well. That's the first step. But to really get the health benefits, I think what I think Dr. Weiss and what we're seeing through the Compassion Institute and the science that supports it, to get the maximum health benefits, you actually need to move one more step. And that's to go from this kind of inner dialogue, inner habit, inner reflection, and now take that habit of mind and build it outward. Focus on relationships, on the connections between all human beings, on understanding how to relate to and how to bring your best self forward in situations that are challenging. And that's why the compassion cultivation training in particular, as one of many different contemplative or meditation-based practices that you can engage in or learn, the reason it's so powerful, that's why it's being used with police officers, in prisons to reduce violence and to improve relationships between corrections officers and inmates, in police community relationships, really addressing this medical doctor-physicians initiative. In fact, Dr. Weiss here heads up the Compassion Institute's program initiative to develop a specialized version of compassion cultivation training just for physicians in high pressure or highly stressful or challenging specialties. So I guess I want to say that in that whole world of self-help, I mean, there's no free lunch. You don't get, to take a mindfulness pill or a compassion pill and all of a sudden, transform yourself into this, amazing Buddha-like person. But I will say that if you're willing to, put the time in over 8 weeks, one night a week, try the course. I mean, it's available in San Jose. It's available in Campbell. We have excellent certified instructors, go through a rigorous 1-year program to learn to teach. Try it. Or read Thupten Jinpa's book, A Fearless Heart. But I mean, there are things that you can do yourself. And if it isn't compelling, then don't take the next step. But if it is, try it, because it might really make a difference in your life.
And I think a simple way to think about this impact is that because of the kind of overwhelm many of us experience with technology and the ongoing nature of communication right now, at the same time, there's an epidemic of social isolation. And this sense of isolation and being alone isn't just a psychological problem, it's a physical problem. And if you think about what is the opposite of being isolated and alone, it's being connected and compassionate. So this is a way of really, if it's not through our compassion training program, but I would implore the viewer to find some way to look at the question of what am I doing to increase my social connection in my life, in my community, in my family, wherever it is. And this is the day-to-day sense of self in relation. And the other piece I wanted to come back to in your question around the relationship with mindfulness and compassion, I think this also relates to the distraction issue, because if we are distracted on our technology or with what's going on in our own heads, we don't notice suffering. We don't notice the suffering in the person at the cubicle next to us. We don't even necessarily notice the suffering going on in ourselves. So we're just distracted, suppressing or ignoring, and all of those issues catch up with us both psychologically and physically. And that connection is so strong between the mental distraction and the lack of social connection and this lack of human connection.
Well, in Silicon Valley, there's been a number of lawsuits where people feel that the women feel that they're not valued in a tech company, even though they're all engineers, and that there is a lack of connectivity in general. And you're speaking to that. And I think to their credit, Apple, Google, they all have meditation rooms. They're trying to address that. They have wellness coaching. So tell us about that.
Well, and I think part of what the paradox here is we need some sort of training to come back to this basic human understanding of relating to the people around us, and relating to ourselves and our bodies, so that we don't spend a 10-hour workday just living between here and here. That taking the time to even take short breaks in a meditation room or walking, or even mindfully having our cup of coffee, or taking compassion as a core value into a meeting that we're having with people. So we're actually trying to understand where they're coming from rather than waiting in ambush to make our next point and get people on board. And what I hear from the many companies in this area that are investing in this is what they really are, they understand that for people to work together effectively requires solid relationships. And there's a lack in our education these days in the emphasis on how do you get there. So I think right now we're in a time both in engineering as well as management training, healthcare, where we're looking again at how do we bring the emotional intelligence back and the compassion and the presence. And it's this return to these simple but not necessarily easy to do kinds of skills.
It's very interesting. The American Diabetes Association launched a 10-year initiative called Diabetes Support Education Program. And one of their 10 points is your emotion. And so when they train these diabetes educators to talk to diabetic patients, they want the patient not only to note down their blood sugar, their hemoglobin A1C, what they ate, etc., but their emotion, because they know that diabetes is a chronic disease, people get depressed, and if you're depressed, you're not going to be adherent to your medication schedule. So this is really cutting edge in a way to sort of get more of us in the home audience, patients, we're all patients, all of us are sick at some time in our lives. And even if you're a little kid, you break your leg, you become a patient. And that little kid needs to feel that there's hope, the leg is going to heal. And I have a question. You know, in Palo Alto, they have some high school students who commit suicide, and it's been in the newspapers. Has this been in the schools yet?
Yes, let me speak to that, because one of the programs that we have at the Compassion Institute is working with the Institute for Social Emotional Learning and with CASHL. These are the organizations that train teachers how to teach in middle and high school settings, students to find nonviolent ways to settle conflicts, to be more body and emotionally aware, to have stronger connected relationships with their teachers, with each other, with their families. But what we've learned, or what we've seen, is that you can't just kind of go to the freezer and get the box. You can't just provide a toolkit of little lessons to teach. And in fact, one of the observations that's taken place is that while there are many tools available for social emotional learning in schools, you know, the efficacy level of those varies widely. And what do you think the big difference is? Well, what it is whether the teacher models the behavior that they're trying to teach. Nobody cuts through the BS faster than a 13-year-old skeptical high school student. So they can parrot back to you what they're taught in the social emotional learning class, but if they then see that teacher send Frank to the principal's office without even listening to what was the problem, or get in a fight with another teacher or administrator, you know, it goes right in one ear and out the other. So what we're doing at the Compassion Institute is really focusing on the teachers and saying, how can we help that person remember why they became a teacher? They wanted to help kids. It's opening their hearts up and getting them to really listen to the students in their class, to model the behavior that they want the students to listen to each other. You have to start by listening to them. So we try to permit a lot of those teachers who face many of the same kinds of stresses and empathy burnout. You know, not all their students have good home lives. Many of their students are angry and frustrated. You know, they have the same problems of empathy burnout that the doctors are facing. And what distinguishes the compassion training program from a sort of traditional meditation or mindfulness program is that while mindfulness and some of these more popular meditation programs are very inwardly focused, you know, they really are about, you know, almost damping down your emotional response. And I'm oversimplifying, of course.
We have about 3 minutes.
What's great about compassion training is that it really is about relationships.
We have about 3 minutes. What would the 3 take-home messages you'd like the home audience to have about compassion training? I think it's a great topic. Tell us.
I'd say start by paying attention to the role of embodied social connection in your day-to-day life. So how much are you spending time with the people that you're with? Not virtual time, but real time together, and what are those connections like would be one place of inquiry. What would you add?
I think you should take the class. I mean,
Take the
give it a
class.
try.
Yeah.
Go to the CompassionInstitute.com
And be open
website.
to it.
And be open to it. Yeah, you have to. I mean, we have police officers that start and they, kind of start like this, and we hope that over 8 weeks they are like this, So let's, give it a try.
So to sum up, think about your body, your mind, you're a total person, and that it means really deeping deep in yourself to what you once were, your happy little kid running in the sands of, Santa Cruz, and be open to it, and that you can lengthen your telomeres, live to age 120 or 150, and take the class. So www.compassioninstitute.com, Palo Alto. We're thrilled to have Dr. Leah Weiss, lecturer at Stanford University, founding faculty member at Compassion Institute. Casey Branscomb, executive director, Compassion Institute. It's really a very interesting topic. And if you like the show, donate to KSAR TV, Saratoga, and join us next time. Thank you very much.